Good day, global citizens. Welcome to another episode of Dr. Fajembola's Opinion. I'm so happy today because it's the first time we are discussing something different, which is diabetes. And on today's episode, please join me to welcome Dr. James Success Odubia. Did I
Yes.
pronounce your surname right? Odubia.
Yeah, Udubia.
One who goes into research, that is invested in research like you do. If you are following Dr. Dubia on LinkedIn, you have seen how he shares his research publications. And for me, I feel anyone that goes deeply into research, they have an interest in academia because for you to stay in academia, you have to like keep up publishing, like the normal saying, you either publish or you die, something like that. As if there is a common saying like that,
Exactly.
publish or die. So it's great to see diabetes is that it can affect every any organ, and we are focusing on the effects of diabetes today on the eye. So Dr. Dibia, in put terms, you talked significantly on you discussed diabetes significantly in the paper in relation to two drugs. One is
Yes.
ranibizumab and second bevacizumab. So first, Dr. Odubia, what is pan-retinal photocoagulation? Because you are using some terms in the paper, and I feel for anyone to understand what they're reading, even for you to understand these terms, you already understand the whole paper as a whole. So, what were you trying to say up on pan-retinal photocoagulation?
We are in a 21st century where we are gradually leaving infectious disease behind because irrespective of the emergence or the re-emergence of any infectious disease now, at least in one way or the other, you will have seen something to cushion it. For instance, the outbreak of monkeypox, smallpox, you will still see one or two vaccine that is kind of related that you can easily give while you actually await the clinical trial of the new ones you'll be what is it called, that will be coming. Is a treatment where the doctors will make light at the back, most of the time at the back of the eye, and the purpose of this basically is to reduce the eye demand, the eye demand for oxygen, number one, and also to stop the new vessels that are growing. Most of these new vessels will always be dangerous and can easily burst. So because of this, just like you are wedding up something to prevent the leakage. Do you get now?
We know that there, in relation to diabetes, like there is the reversible form and the irreversible form. An example of the reversible form is there's gestational diabetes and pre-diabetes. But uh, I want to know, as diabetes mellitus is a complete discussion because it was repeated severally in the paper. VEGF upregulation promotes neovascularization, vascular leakage, retinal edema, eventually leading to irreversible blindness if untreated.
Hmm.
Please shed more light on this.
Okay, so basically, the reason why we kept on using VEGF is because is the context of the two drugs we are trying to compare. Both drugs are anti-VEGF, so that is why we are trying to make VEGF pronounced so as to bring context to the two drugs we are trying to introduce or we are trying to work on. So basically, when diabetes damages the eye, the body reacts by too much of chemical called the VEGF. So that buttresses the explanation of VEGF that I've said in the latter.
Um, Thank you so much. As I'm discussing with you, because I read the paper fully, as you're explaining, I'm getting more insight on the paper.
Yes.
Please paint a picture of diabetic macular edema. When they say diabetic macular edema, what is the picture that comes to your mind?
Okay. just just imagine looking through a camera lens, for instance, using the camera lens as a eye now. So, and the camera of your phone, you just see that, or you just notice that there is water trapped inside it.
Hmm.
Just imagine it that the camera of your phone, there is water that is trapped inside it. That is what diabetic, what's it called, edema is like. So the macula, which helps you to see clearly, this camera will help you take clearer pictures, but now
Yes.
there is a kind of a sprinkle of water on it.
Yes.
So which helps you to see clearly and in details, swells up, because this VEGF that we've been talking about since, eh, weaks body, the blood vessel leak fluid into it. In the process
Yes.
of VEG trying to protect now, so there is a leakage that drops in form of water now to the macula that is supposed to help you see clearly. So this makes the vision very blurry, distorted, just like you can no longer take good cameras with your phones, and because of the blurry of the, what's it called, camera, courtesy of the water. So the water sprinkle on that camera, the water is now the VEGF, while the camera is now the macula that you are supposed to see clearly with. So that is just the
Beautiful.
scenario, a kind of a layman scenario as regard, what's it called, DME, which is
Thank you so much.
diabetic macular
Thank you so much,
edema.
Dr.
So that is
Dubia,
it.
for that simple and beautiful explanation.